This is a very common question I get about blood findings, and very, very common to see people confused about when they go to the medical doctor. They say, "Doc, I got these symptoms," and it could be like either weight gain or fatigue or hair loss, and the doctor's thinking maybe thyroid is a problem, or their metabolism or their ability to heal is slow. That could be thyroid. So they check their thyroid in their blood, and everything is normal. So how can that be? But they still have symptoms. So they say, you know what, everything's okay with you. So this is why I think this is the problem, because I see this quite a bit. So if you take a look at these numbers right here, these columns right here, this column particularly here, I'm sorry, wrong page. Okay, this column right here is your clinical findings. So say blood glucose is 65 to 99. Do you know where they get those numbers from? All this column here on the clinical, that's the lab values. You know where they get those numbers from?
No.
The average population.
Oh, okay. So
that's why they're changing the numbers all the time. So do you think that the average population is getting healthier or sicker? Sicker. There's more diabetes, more heart attacks, more cancer. I mean, it's more autoimmune, more new conditions, ADHD, autism, new conditions that they've never seen before. Alzheimer's, Parkinson's, you name it, everything is getting worse. Well, so my question is, the way I look at it is this. Say 65 to 99 is the clinical value. That's the average population. So if you're out of those values, that means you're sicker than the sickest in the population. You're sicker than the population, basically, which is already sick. So that means it's not good. Any of these red values here are out of that range. The blue values are out of that range. But the yellow values are near the cliff. What's the cliff? The cliff is 65 to 99. If you're less than 65, you're off the cliff. If you're more than 99, you're off the cliff for glucose. So my question is, say the doctor finds you at 98. Well, 2 more points and suddenly you're off the cliff. Is that normal? Is that good? I mean, does it make sense? Well, I was in the range, 99, then suddenly, boom, I fell off the cliff. My question is, do you want to stay close to the edge of the cliff, or do you want to be optimal, like far away from the cliff?
Right. Far away from the cliff, of course.
That's what the yellows are. The yellows are showing here that you're nearing that cliff and you're getting ready to fall off, and the doctor's going to go, wow, you know what? You're off the cliff. But some people, everything is yellow, and they feel like a mess. Right?
Okay.
They feel like a mess because everything's yellow, but the doctor doesn't say anything that's wrong because they're still in that range.
Right.
They're not off the cliff yet. So the way I look at medicine or medical doctors in general is they're great at acute conditions. They're great when you fall off the cliff.
Right.
But there's so many conditions out there that lead to that cliff, like cancer. You don't see cancer in these blood findings right away. So that's why we measure those and see, over time, are you getting towards the cliff or are you staying hovering in the middle? And that's where true health is, because now you're constantly staying away from the cliff. Does that kind of make sense?
Right, yeah.
Do you have any questions about that?
No, that part I understand. So, so basically, as far as your findings, when you are saying you're pre-diabetic, you may not even be in the low range of diabetes.
Right.
Or it may not even necessarily be right under it, but you're heading in that that direction.
Correct.
And your numbers are higher, but not necessarily in the range that the medical field shows that you would be.
Right. Who said you were pre-diabetic? Was it me or the medical doctor?
You.
Okay, right. So, it's yellow, basically. It's yellow. You're getting towards that higher end. And I've heard that they're even considering changing the hemoglobin A1C, which is the true measure of diabetes, to a higher level, like 7 or 8, which is crazy for kids. So what does that do? If they change it to a higher level, it means they're allowing these kids to have more carbs, basically. Because why? Most of them are like that.
Right.
They're saying, well, that's the average population now. They're all 6 and above. So let's change the range. Well, now parents won't feel bad because they're feeding their kids too early, right? Because, they're in the range. And then now you've got a population that's heading for 100% diabetes. Think about that. We're heading towards most of the population getting diabetic because they change the range. Vitamin D is a classic example. Used to be 30 to 100. Now they're reducing. They're probably going to change it to 20 to 100 because that's the average population. It's getting lower and lower, the vitamin D, and vitamin D is such a critical thing for health. And so, yeah, I like the vitamin D 50 and above, 50 to 80, even towards 80, just because that's much healthier. Especially during the cold season, flu season, vitamin D is known to affect your immune system. And when you have enough vitamin D, you just don't get sick as often. So, any other questions about that? Because those are good questions.
No, that makes sense. Yeah. So, I mean, if someone